Hello everyone, I'm going to tell you about mhealth as a relief in the COVID-19 pandemic. My name is Juana Valentina Camacho Vaquero and I am a biomedical engineer. At this moment, maybe you had COVID or someone of your family did. Well, the contagious stage of COVID-19 in 2020 had a worldwide impact and unfortunately, many lives were taken. Formerly, the COVID-19 pandemic, also known as the coronavirus pandemic, is an ongoing global pandemic of coronavirus disease caused by severe acute respiratory syndrome. The virus was first identified from an outbreak in the Chinese city of Wuhan in December of 2019. All the attempts to contain the virus failed and allowed it to spread all over the world. But each of you already know this, right? I would like to be talking about a rare disease that few of you know about, but the COVID pandemic changed our lives in a radical way. Due to this, we had to adapt, and what I am here to present to you today is part of that change. As a product of the proliferation of the virus, there was an overpopulation of infected people in the intensive care unit (ICU) and shortage of medical staff. If a person has suspicious symptoms or requires follow-up during the infection period, a trip to a medical center should be the last option to take. Why? Don't go to the hospital if you don't have to. At this moment, the medical staff is really reduced, and due to the mobilization of uninfected people from their home to the medical center, other people can get infected and increase the transmission of the virus. So, what should we do now? I'm going to present you mHealth as a solution. mHealth is an abbreviation of mobile health and refers to the support of mobile devices to the practice of medicine. You may already be familiar with certain types of wearables, device that you wear, and constantly measure physiological variables in you, such as smartwatches, like the Apple Watch. These devices takes the user's temperature, oxygen saturation, heart rate, and other physiological characteristics. Due to this constant measurement, many conditions and diseases can be detected in time. There are four categories in the mHealth field: diagnostic support, treatment support, helpline, and data collection. Today I'm going to emphasize in helpline category. The solution of this problem is a chatbot. Chatbots are computer applications based on artificial intelligence that allow you to simulate a conversation with a person, giving them automated answers to their most common doubts or questions. A chatbot can replace medical staff in tasks such as fear diagnosis, provide information on care, and answer frequent questions from users. So, chatbots decongest the medical centers because a chatbot ensures that the medical resources are used only in patients who require them and helps to decongest the medical centers, like I said. Thank you and stay healthy.